Hello, everyone. I'm Martin Somorjai, the sexologist. Currently, you are watching the dress rehearsal of the Psychiatrists Conference. I am preparing with this presentation. I have been working as a full-time sexologist since 2016, both offline and online. The latter was necessary due to the rural and urban clients presented above. I deal with various sexual problems, and I have specialized in porn addiction. In 2018, I conducted qualitative research in the context of pornography. Despite working with in-depth interview methods, I conducted these online as well, partly because I was sure that due to the sensitivity of the topic and the immense sense of shame, I wouldn't find people willing to speak in person. And so online, it was easier to respond under the guise of anonymity to my questions. I published the results and part of the methodological recommendations last year in my book titled How to Manage Porn Addiction. I plan to gradually transition to online education, addressing sexual problems, not just porn addiction, but also each other. Through audio materials, video materials, and online consultations to show the thought process, or at least provide some guidance. In our current presentation, I summarize the advantages and disadvantages of offline and online sexological counseling, indicating them. First, I analyze two of my cases, then I synthesize. First is at online, Akos. Of course, this is a fictional name, but the case itself is not fictional. A 34-year-old married man in a relationship for 9 years seeks help due to erectile dysfunction. At the same time, he is known to have a pornography addiction. There is always a fundamental problem that they approach me with. In this case, it is partial impotence. During the detailing of the current condition, it turns out that he struggles with concentration disturbances during intercourse. To bring this to the surface, a deep exploration of the current situation is conducted with a barrage of questions. I keep asking about the most minute sexual details until all necessary information is revealed. One cannot inquire about the sexual life in a vague or superficial manner. For the sake of effectiveness, it is necessary to know almost everything. Where the sexual act takes place, at what time, on which days, approximately how long it lasts, how it begins, continues, and concludes. How much each person enjoys it, what Akos thinks about during it, what their arousal curve is like, and approximately how many peaks and valleys it has, which. To learn even more about the existence of his potency problem, I call upon cognitive behavioral therapy for assistance. He needs to log his erections and review the data before consultations, so that I can analyze it and find correlations in the case. It turns out that he uses potency enhancers and is already dependent on them, which is something many men experience today. They don't even notice, and one can become dependent on Viagra and similar drugs. Without them, they can no longer achieve arousal. So, the therapy immediately prohibits their use. During this first session, I also inquire about the relationship. According to Akos, everything is perfectly fine between them. They want a baby, but it's not happening. During our second session, we conduct the anamnesis. I want to know everything related to love and sexuality. From birth to the present day, if necessary, I also map out other information. Going back to the grandparents, I don't find any significant trauma in Akos's past, nothing that would explain the minor inferiority complex and performance anxiety that later comes to light. Clearly, all his issues are related to sexuality. The only interesting thing is his inexperience. His wife, the second, is almost his first love in life. This is when we turn to the act of watching porn. He declares himself to be an addict. For addicts, it's customary to ask 15 questions, such as where they do it, how they masturbate, how they watch the films, what they watch, on which platform they watch, and how much time they spend on it. And these are not sub-questions for no reason. I commend him for giving up the potency enhancer. Due to cross-addiction, I don't burden him with quitting porn immediately as well. During the third session, I invite his wife as well. This is the only occasion when they can appear together. Although for a reason I mostly hold a single joint session for the leader, it's rare to have more than that. In my methodology, it is not advisable to listen to them together. There are several reasons for this, and if there's time, I'll elaborate on them. Among other things, there is a strong focus on the difficulty of having children. I determine that his wife is pressuring him, and he experiences a lack of self-confidence because he cannot name what it is. I observe how they sit in front of the camera. To me, the supposedly good relationship seems cold. Since I cannot give honest feedback in front of the couple, I ask his wife to schedule a separate session with me. During my meeting with his wife, I delve deeper into their relationship, and this is when the essence becomes clear. Akos is selfish. He provides neither intimacy nor sexual pleasure. His wife has already resigned herself to this. She just wants a baby. I ask her to refrain from mentioning the word child in front of her husband for now. She promises. Instead, I suggest topics that promote intimacy, openness, and facilitating conversation. In the next session with her husband, my goal is to bring the focus onto selfishness without explicitly stating it. I guide him towards it. I ask somewhat roundabout questions that confront him with the fact that someone who behaves this way with his wife in bed is indeed selfish. Fortunately, he gets the hint. This is when he realizes that he is selfish. This is the joint work, the dramatic climax. This coincided with his porn addiction, which I also categorize. In this case, the category is not sexual, degree. HAL group, repressed emotions, group with inhibition in expressing emotions, and low self-esteem. I established the categories in the associated groups. Each group requires a different method to lead. The method can be read about in the book titled How to Handle Porn Addiction. In Akos's case, the goal will be emotional development. Akos needs to dynamically change his approach towards his partner as well. Start, conduct, and finish sexual encounters differently. Simultaneously, I also treat him with my own self-confidence boosting method, as the lack of self-confidence is based on the consequences of partial impotence and infertility. Out. Thus, all his problems are addressed simultaneously in parallel. He is a moderately severe addict, someone who can be burdened, and responds well to these methods. As his development progresses, his relationship deepens. He turns away from porn more and more, and almost imperceptibly stops it. I really love it when my clients quit without even realizing it. It happens that during several consultations, porn doesn't even come up. And when I ask about it, they tell me it's been months. They just don't watch it anymore. They just forgot to mention it. So in Akos's case, I can say that we managed to solve multiple problems at once, just with the help of online consultations. He describes our work together differently, which can be read in the feedback section on the website. For the 34-year-old man, my second case for Lajos, 5 offline sessions. Also, from 2018, I intentionally chose 2 clients from the same year so that it cannot be said that in a later year, I am already looking for more risks. Whom I called Lajos, here, the 42-year-old man, single for 8 years, comes with difficulties in meeting people and forming relationships, not suspecting that his problem is caused by porn addiction, as he is not yet aware of the addiction. Currently. In 2021, today everyone knows it exists. But in 2015, when I noticed the opportunity, I still had serious professional debates even. In 2017-2018 as well. But fortunately today, this perspective is recognized. So an easy case arrives, one might think, since Lajos is merely starting to use my prestigious service. However, it turns out that Lajos not only has a pornography addiction, but also a video game, crossword addiction, and numerous psychological issues. He is a severe addict who spends 6 to 8 hours a day indulging in his addictions. And on average, he masturbates 10-15 times. I also consult with him for 60 minutes every 3 weeks. As part of the practice-oriented integrated methods, he is given specific tasks to complete between sessions. He receives tasks as well. He also has to write a journal, like Akos, but with a different purpose, which is to observe his initiatives towards women and to validate his related emotions. For his addictions, I apply relaxation methods and life coaching. He also participates in confidence-building sessions. In his conflicts with women, he reports back, I find a lack during analysis, the root cause. Often, he doesn't understand women, which is why he fears them. Therefore, I develop him with empathy-checking role plays. I impersonate different types of women, whether they are known to him or a potential subject at the library he frequents. And also to place him in the role of the artist. I believe these role plays are easier to conduct in person. Online, it might not have been as easily interpretable. Gestures and facial expressions, but I don't know what would have happened if continuous sex education, enlightenment about how relationships work. He asks a lot of questions, as if he weren't an adult with 2 degrees, speaking 2 languages fluently, but rather a sexual person. From a point of a little adolescent, he started from very deep, but achieved dazzling success, which is also due to the fact that he continuously took notes and followed everything. He completed all the homework with precision. Erectile dysfunction also appeared, which occurs in almost every adult male. Sooner or later, yet he didn't have to deal with it too much. After 8 years of being alone, he got a girlfriend again, quit both of his addictions, and even his aura changed. He wrote an absolutely amazing feedback. This is how you handle turning addiction, to my themed book and for my tomorrow, in which he listed about 27 mental issues that were present during our joint work. Now I will move on to the synthesis. In what cases is it better to work online? Advantages of online consultation are the number of therapists, safety, and compensated deck. There is a factor that we rarely talk about or learn about. This is the protection of the psychologist, therapist, helper, sexologist. We always learn about the clients, what is good for them, what we need to do for their protection, but not about what needs to be done for the therapist's benefit so that it is good for them. If the therapist does not feel well, does not feel safe, comfortable, or at ease, if the conditions are not ideal for their work, then they cannot give 100%. And this is the profession where you always have to give 100%. Therefore, the therapist must pay special attention to their own comfort and safety, and their well-being, so that they work at times when all conditions are met for them to feel internally comfortable. With this element of comfort. Travel. The comfort factor is not negligible, as our work is extremely difficult. It is not disadvantageous if at least our comfort is ensured, given that our profession demands so much from our minds, hearts, and souls. It's comfortable if the assistant picks up the phone, turns on the computer, instead of traveling to an office to meet clients. During travel, the husband may become irritable. If he's driving, it could be due to traffic jams or other drivers, due to the unpredictable delays of trains. On buses, a single unpleasant word from a fellow passenger is enough to mention just a few possible negative impacts. It's nice, but often tiring, while it's important for an assistant to be mentally prepared, starting the consultation fresh and fit. All of this is advantageous from the client's perspective as well, of course. The client can relax more easily in their own home, provided the conditions are suitable there. It's also pleasant for them not to have to travel and to find their way to the computer. They are not late. So the usual excitement factors that might cause anxiety are already eliminated. In their familiar environment, the client feels more secure. They don't need to prepare much, just turn on the device. Cleaning. It seems trivial, but for someone who often receives clients at home, they need to clean before consultations. Nowadays, they also need to thoroughly sanitize. In the practice, there isn't always cleaning staff on standby. If someone doesn't receive clients in person, they can save on these tasks as well. Minimizing risks. Let's admit this is rarely discussed, but this profession is not a life insurance. A client can attack a therapist at any time for various reasons. Here are a few. Psychiatrists often encounter self-destructive and dangerous patients. Such a person might have a fit of rage and physically attack the psychiatrist. It can also happen to psychologists.